Hi, my name is Savina Nityanandan, and welcome to this episode of Lifestyle Matters. Today, we have a different type of episode where we have a guest with us, Julie Schultz. Julie is primarily a physiotherapist and has wears numerous other hats, including a health coaching in autoimmune diseases. Julie, would you like to introduce yourself?
Hi, Savannah. Thanks for having me on the show. Yes, well, I guess my background is I'm a physiotherapist with a postgraduate in women's health and clinical Pilates, and then I guess the other strings to my bow are health coaching. First of all, functional medicine health coaching, and then I went on to do mind body eating coaching, and then became a lifestyle medicine practitioner and recently just accepted in as a fellow into the lifestyle medicine for Australian Society of Lifestyle Medicine. So yeah, I've slightly changed track a little bit, but certainly still in the health industry.
Yeah. So, how did you go into health coaching?
Well, it's going to be a long story very short. Essentially, I've been a physio for 20 odd years, and after I had my third son, a couple of years afterwards, I still felt like had a newborn child. I was so tired and I was unwell, had very bad joint pain. Essentially, I eventually got diagnosed with lupus, which is an autoimmune disease, and I guess like anyone, when you're newly diagnosed, you're not quite sure what to do. And I I guess I found very early on, very quickly, a great doctor who supported, lifestyle medicine and functional medicine approaches. And I guess that's the direction that I've been going in terms of my own treatment. And I found out very early on that I had a decision to make. I had three young boys, and I could either take a very passive approach to my health in terms of just taking some medicines and hoping they help the symptoms, or I could take more an active approach and try to work out if there's anything I could do for myself to help myself feel better, to perhaps slow down the progression of the disease, to put myself into remission perhaps, or simply just to feel a little bit better. And with the help of the doctors I worked with, I've been able to do that. It's been a very long road. It's been difficult at times. It's certainly required a lot of self-motivation and control and hard work. And look, throughout this process, I've kept myself, I guess, more well than the doctors expected I should have been. And I guess it was very strong evidence that taking a lifestyle medicine approach in conjunction to the medical approach was going to be very beneficial. But I think what I had as a physio and a health professional was that I had the ability to guide myself through this process. And I wanted to go and study something which allowed me to help other people be guided through the process. So I went off and studied health coaching so I could do just that.
So, lifestyle medicine and using medicine. I think that's a very important point that you've made there, Julie. And I think that's what, for example, Fergal and I try to do also with in terms of our general practice, where we try to use lifestyle medicine in our approaches, and also a good GP ideally should be able to do some elements of health coaching, which is, what you do. Unfortunately, due to time constraints as general practitioners, we struggle with that unless we sort of take a different approach into practicing medicine. So, what is health coaching though? I mean, I don't think many people are aware of what health coaching is. And could you just take us through a little bit about that?
Sure. Well, health coaching, I guess it's a form of health profession now, but it's certainly and a form of coaching. But it uses the science of positive psychology. So most health and wellness coaches will be trained in a form of coaching which includes positive psychology, behavior change. So using the techniques of motivational interviewing, looking at people's nutrition, their exercise, and certainly all the components of lifestyle medicine, looking at their stress, relationships, sleep, all those types of things. So I think health coaching it incorporates a lot of things. A good health coach will help facilitate change in the patients or the clients. They'll help be a good motivator. Um, support them through goal setting, help them, I guess, find that big picture health and wellness goal that they want. Perhaps be someone that they're accountable to, or you're someone they're accountable to. I think we just have more time that we can spend with them, where the medical doctors obviously need to spend the very important time on diagnosing and treating. And then a health coach can step in. This is where a partnership between doctors and health coaches can be very effective, is that then we can help carry out the treatment plan for the doctor, spending, each week with a client, for example, or, do a 12-week program, whatever it is. But I guess just facilitating the changes that need to be made.
Yeah, so the three F's and the three S's for those who have followed our Lifestyle Matters program before, Fergal's three F's and three S's. So basically what you were talking about, stress, sleep, food, fitness, all the sort of things which are really important in terms of our general health. But I guess, to find a health coach, how do we pick a health coach, I guess? Because are they all the same, or is there other differences between different health coaches?
Well, there are differences, and I think, like any new industry, it's been difficult up until the last couple of years to be able to work out what level of health coach you're getting. Someone could have done a weekend course, and other people have studied for 2 years and done a big practical component and whatnot. Fortunately now, through the very hard work of some colleagues of mine, there's an association that's been set up in Australia. It's called Health Coaches Australian and New Zealand Association, and it has on there a list of coaches, a place where you can find a coach, if you need one. But what's very important about this association is that only lists coaches who have done an accredited course, and that accredited course has been accredited through a very rigorous assessment process through a national board, Health and Wellness Association in America, and they've worked in collaboration since 2016, I think, with the National Medical Examination Board, and it's internationally recognised. So you can now go onto this site, you can search up a coach, and you can be assured that they've had the training that's necessary to support your patients through what you might need supporting with.
Yeah. And how do you find your job? Like, do you find it rewarding? Have you got any stories to share? I mean, you've shared your personal story, which was great. Obviously, it's helped you quite a long way. But do you have any stories to share, or yeah?
Oh, I feel absolutely privileged to be able to support anyone through a journey, particularly when they've got a chronic disease. It's lifelong, and it can be a very long journey, a roller coaster. And being able to hold someone's hands through that, or see their changes that they can make, to be able to sit with someone when they set a health and wellness goal, and then sit with them on the other side when they've achieved that, is incredible privilege. And I absolutely love
Yeah.
this profession.
Yeah, as a GP, so once again, when we talk about health coaching, my main issue when I try to enlist a health coach is I find finance is a huge barrier for my patients to access a health coach. Do you have any words of wisdom around that?
Look, I think it's challenging still, because it's certainly not covered under Medicare. Some of us, of course, might put on our other allied health hats, such as a physio, and use coaching techniques. But to be an actual health coach is not obviously covered by Medicare yet, so it is a private service. People exploring different ways of doing it, such as setting up small groups who might have a similar type of issue, say a group of people with diabetes or pre-diabetes, or depression, or a certain autoimmune disease. So being able to group people together and have a health coach guide them through a program is probably an effective way of doing it. I guess it's an investment into people's health. That's this preventative type of care is a different way of looking at medicine, isn't it? I mean, sometimes I talk to my clients about what you invest now hopefully stops you needing to invest a lot in treatment and hospital visits down the track. So it's perhaps a different way of looking at it at this stage.
That's a very good point to make, Julie. We often think about the here and now. We don't think about the 10 years or 20 years down the track. So sometimes it might be worthwhile just putting in the investments now so that we can save for the future and not needing, chronic disease treatment later on for whatever it may be. So I guess what we'd like to explore, I guess, in the next episode would be more along the lines of, what we were talking about, like positive coaching, motivational interviewing, some of the things that you do as a health coach so that our audience knows a little bit more about it and they can access it if they feel like they find it more suitable for them.
Yes, I agree, Savina. I think that would be very valuable for your audience to understand some of the techniques that we use.
Yeah, great. Well, looking forward to the next episode then, Julie. Thank you for your time today.
Thank you, Savina, for the talk.
Well, that's it for today's episode of Lifestyle Matters. We'll see you next time. Thank you.